Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Basically, the brains use tiny electrical signals to control everything we think, feel, or do. A seizure is basically when a person's brain is overloaded by an abnormal amount of electrical activity. Uh, some people also describe a seizure as a storm in the brain. So, during a seizure, a person might lose consciousness, shake or convulse, become confused, or even feel sudden fear or panic.
What is epilepsy?
So, epilepsy is a medical condition that causes a person to have repeated seizures. So, generally, a doctor will diagnose epilepsy if someone has had at least two unprovoked seizures, which means that the seizures weren't caused by something else, for example, a high fever or a severe infection. Epilepsy can include many different types of seizures, and while some people only have one type, others may experience more than one type of seizures.
What are the different types of seizures and do they affect people differently?
Yes, there are different types of seizures. They depend on where the unusual activity starts in the brain and how much of the brain is involved. So, we usually classify seizures as either generalized or focal, which is also known as partial. Generalized seizures involve the entire brain, whereas focal seizures start in one specific area of the brain.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not always. For about half of the adults with epilepsy, we may not be able to find a specific cause. But for the other half, common causes can include head injuries, brain infections, and sometimes tumors. For people over 65, strokes and Alzheimer's disease can also lead to epilepsy. Genetics sometimes plays a role, especially if there is no other identified cause. Researchers suggest that certain genetic factors might make someone more likely to develop an epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
The symptoms of epilepsy can vary a lot, but some common signs of a seizure include sudden convulsions, jerking movements, losing consciousness, staring off into space, confusion, and even sudden fear or a strange feeling. Some people may shake in just one part of their body, like an arm or a leg. If someone you know has these symptoms more than once, then it is probably a good idea to talk to a doctor.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, unfortunately, epilepsy has been misunderstood for a very long time. Historically, people did not realize that epilepsy is a neurological condition, and myths developed around it. Seizures also look frightening, so people may react with fear or even avoidance, which leads to stigma in the society.
How does this stigma affect people with epilepsy?
Unfortunately, individuals with epilepsy often face a negative attitude and discrimination from others. These negative attitudes are reflected in the reluctance to marry epilepsy patients, and unwillingness to employ them, aversion to being in the same vicinity as them, and even discouraging their children to play with other children who have epilepsy. Research has also been done on this, and it has shown that stigma can increase the frequency of seizures because stress is a common trigger. That is why our community needs to be informed and supportive about this.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
The trigger for a seizure can vary from person to person, but some common ones are missing sleep, high stress levels, skipping meals, flashing lights, fever or an illness, missing doses of seizure medications, which is one of the most common causes. And in women, hormonal changes during the menstrual cycle can also precipitate seizures. So, maintaining a seizure diary to track possible triggers will make it easier to notice such patterns.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So there are several healthy habits which can reduce the risk of seizures. Uh, it is always encouraged to get enough sleep, as fatigue is a major trigger for many people. Eating regular, balanced meals and staying active can also help. Physical activity is generally safe for people with epilepsy, though it is good to avoid extreme or high risk sports without talking to your doctor. Managing stress is essential, and that could mean practicing relaxation techniques, talking to a counselor, or joining support groups.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yeah. So at home, it's always wise to clear away things that could cause falls, such as cords or clutter, and to pad sharp corners on tables. In the kitchen, one should use non breakable dishes and consider using the microwave when alone rather than the stove. Also, placing soft carpeting can help reduce injury risk if someone does fall during a seizure. These precautions are very simple, but they can make a huge difference in the lives of seizure patients.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
I would like to say that with the right treatment, many people with epilepsy can manage their condition very well and lead full lives. Being aware of triggers, practicing healthy habits, and having support makes a big difference. And remember, you're not alone, there's a community of support out there.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.